I am Ashley Jalifka, and this is my husband, David Jalifka. Before we got married, we made a deal with each other that if we weren't able to have children naturally, we just weren't going to have children at all. And then we found out that we couldn't. And I think it just kind of telling us that we can't have something or we can't do something, especially me. I don't take that answer. I'm just like, nope, I'm gonna prove you wrong.
My name is Drs Shahryar and Parviz. I'm a reproductive endocrinologist at Austin Fertility and Reproductive Medicine.
My name is Parviz Kavusi. I'm a reproductive urologist at Austin Fertility and Reproductive Medicine, Westlake IVF. I'm the male fertility specialist here.
It is a true privilege to be able to work with our patients who want to build their families. It's a very unique opportunity.
And it's a very stressful time for them, so they need a lot of emotional support as they're working through this process. I mean, the truth is no one expects to be in our office, right? I mean, no one thinks that they're gonna have this challenge, and it's very common.
We have a very unique practice model where we have reproductive endocrinology and reproductive urology under one roof. We have laboratory staff and we have a laboratory facility, the IVF lab, and we have our andrology labs. And our embryologists, our andrologists, we're able to take care of these cases in every possible manner, in the operating room even. This was in an academic setting where we saw this model and we're able to translate into the private practice setting, and we were the first in the United States to be able to do so.
That really gives couples a sense of comfort. Going to the same place, they're familiar with the staff that takes care of them clinically, and that puts them at ease.
The whole Austin Fertility and Reproductive Medicine team, they were just wonderful to work with and prayed with us and cried with us, and just made us feel like family.
It was a little tricky, but of course we were doing it together and we were like, we're in this together. Like, we'll just keep going down this road, and wherever it leads us, that's where we're gonna end up.
The fact is that the male factor has been really ignored for a very long time, and the burden of fertility has really fallen on the female side. That's where the onus has been for years and years. But the truth is, about 60% of couples that have trouble conceiving, there's a male factor involvement. With more science, more research, and more understanding of male infertility, we really understand how that's incorporated for an infertile couple, and it's given us a lot more options to help those couples conceive in ways that are fit for them individually.
We do see some cases that are simpler than others in terms of medical management or surgical management or a mix thereof. There are some cases that are much more complex. They're more difficult and more challenging.
Once a week, we have an IVF meeting that really covers our more complex cases, whether it's male factor, female factor, or both. That includes reproductive urology, reproductive endocrinology, embryology, andrology, our entire clinical team. And so every week we meet and we go over our cases that are more complex. And so everybody's on the same page. All the questions get answered, all the I's get dotted and the T's get crossed. So there's no questions remaining for how we're going to care for that couple.
Every step in our journey, they were like, what do you guys need? Are you guys doing okay? Do y'all need to come into the office? And we're like, no, we're great. Or like, yes, I could really use somebody to talk to. Okay, let's set you up. Let's get you in here. So, they were just great.
The majority of our job is taking care of patients, and that's really where our focus is on a daily basis. But along with that, we also recognize there are still great deals of gaps in knowledge in infertility on the male and female side. So although we're in private practice, we dedicate a lot of our own time to research, whether that's basic science or clinical, and we continue to try to learn to advance the field.
It's a privilege to be able to help these couples. When something works in this field, when we get a live birth for a patient or a couple, it is the most amazing feeling. It's awesome to be able to see them achieve their dreams.
We have two boys, Jax, short for Jackson, and Jace is our second. He is going to be 5 months old.
Guys that I've known for years. We used to drink beer and whiskey together, and now we're standing around talking about Bluey, and I'm loving every minute of it.